In the 1940s, a doctor performed over 200 brain surgeries using an ice pick through his patient's eye sockets. Yes, this shocking procedure, known as the lobotomy, was considered revolutionary at the time. Fast forward to today, and brain surgery looks more like something from a sci-fi movie, using lasers, computers, and even gene therapy. The evolution of brain surgery is truly wild, and the advancements we've made are nothing short of mind-blowing. Ready to explore how far we've come? Let's dive in. Number 1. Lobotomies, a lesson from the past. Back in the early 1900s, lobotomies were considered a solution for mental illnesses like depression and schizophrenia. The idea was simple but shocking. Disconnect part of the brain, the frontal lobe, to stop abnormal behavior. It sounds scary now, but over 50,000 lobotomies were performed in the US alone. The most surprising part? Doctors use tools like ice picks, inserting them through the eye socket to break brain connections. Yikes. What's more shocking is that the man behind it, Dr. Antonio Igas Moniz, even won a Nobel Prize for this procedure, but soon people realized the devastating effects, as many patients lost their emotions and personality. The lesson here? Medicine doesn't always get it right on the first try, and this is a powerful reminder that medical practices evolve. Lobotomies were eventually abandoned as scientists found safer and more effective treatments for mental illnesses. While this method is now history, it played a significant role in the development of modern brain surgery. It pushed doctors to ask tough questions and find better, less harmful ways to treat the brain. Today's patients benefit from that growth as the field of neurology keeps improving. Number 2. Deep brain stimulation, or DBS, a real game changer. Now let's fast forward to something way more advanced. Deep brain stimulation, or DBS. Instead of cutting into the brain, this technique uses tiny electrodes implanted in specific parts of the brain. These electrodes send electrical pulses to regulate abnormal activity. Imagine it as a brain pacemaker. Literally, DBS is an amazing treatment for people with Parkinson's disease, helping to control tremors and movement problems. It's like flipping a switch and bringing calm to a chaotic brain. What's so practical about DBS is its flexibility. The settings can be adjusted after the surgery, making it customizable for each patient. It's especially useful when medications don't work as expected. DBS doesn't just help with Parkinson's, it's also being researched for depression and other mental health issues. So if you or someone you know struggles with neurological disorders, DBS is worth exploring with a doctor. The recovery is quicker, and the relief is often immediate, which can make a world of difference. Number 3. Microsurgery, a close-up look at the brain. Microsurgery changed everything in the world of brain surgery. Before this technology, surgeons had to rely on their own vision, which made it incredibly difficult to operate on delicate brain tissues. But with the introduction of microscopes in surgery, doctors could suddenly see even the tiniest details of the brain with incredible precision. This advancement made surgeries like tumor removal much safer and more accurate. Instead of working blindly, surgeons now had a detailed map of the brain's intricate network. The real-life benefit? Shorter recovery times and fewer risks for patients. Microsurgery is especially helpful for tricky surgeries, like repairing brain aneurysms or removing tumors from sensitive areas. Patients experience fewer complications, and surgeons can perform more complex procedures with confidence. If you ever need brain surgery, knowing that microsurgery is an option should give you peace of mind. This technology has made surgeries far safer and more effective. Number 4. Robotic surgery, steady hands of the future. Ever thought robots would be performing surgery? Well, they're here, and they're doing amazing things. Robotic-assisted brain surgery uses machines that can perform delicate procedures with incredible accuracy. The robot is controlled by a surgeon, but it can do things that even the steadiest human hand can't. For example, a robot's movements are so precise that it can navigate through tiny areas in the brain without damaging healthy tissue. The big win here? Robots don't get tired. Their hands don't shake, and they can repeat the same task perfectly every time. This is especially helpful in long surgeries where precision is everything. Patients benefit from fewer complications, shorter surgeries, and quicker recovery times. In fact, robotic systems like the Da Vinci surgical system are already being used for brain surgeries, and the results are incredibly promising. So if you ever hear about robotic surgery, you can rest easy knowing it's a reliable, cutting-edge option. Number 5. Focused ultrasound surgery, or FUS, the sound of healing. Imagine a brain surgery where there are no cuts, no scalpels, just sound waves. Sounds futuristic, right? Well, it's happening now with focused ultrasound surgery, or FUS. This technique uses sound waves to target and destroy problem areas in the brain, like tumors or areas causing tumors. One of the most common uses of FUS is to treat essential tremor, a condition that causes uncontrollable shaking. For many patients, the improvement is instant and life-changing. What makes FUS so practical is its non-invasive nature. Since there's no need to cut into the skull, the risks risks are much lower and recovery times are much faster. In some cases, patients can go home the same day. It's an ideal option for people who can't undergo traditional brain surgery due to health issues or who want to avoid the risks of open surgery. If you're looking for a cutting-edge, low-risk option, FUS is a game changer in the world of brain treatments. Number 6. Computer-guided surgery. Real-time brain maps. Technology is helping surgeons in ways we could only dream of before. Computer-guided surgery is one such example, and it's a lifesaver, literally. With tools like intraoperative MRI or iMRI, surgeons can take real-time images of the brain while they're performing the surgery. This gives them a precise map of the brain, helping them to navigate around critical areas and make sure they're treating the right spot. The practical advantage here is huge. Surgeons can see exactly what they're doing during the operation, which reduces the risk of complications. For patients with brain tumors, this means that doctors can remove the entire tumor without leaving behind any hidden bits. It also lowers the chances of repeat surgeries. It's like having a GPS for your brain, ensuring that surgeons are always on the right track. Patients get better results and fast recoveries thanks to this amazing technology. Number 7. Laser neurosurgery. The power of light. Lasers are no longer just for sci-fi movies, they're transforming brain surgery too. Laser neurosurgery, particularly laser interstitial thermal therapy or LITT, uses focused light to treat conditions like epilepsy and brain tumors. The beauty of lasers is their precision. Surgeons can target just the problem area without damaging surrounding tissue. Their procedure is minimally invasive, meaning only a small incision is needed to insert the laser, leading to a much quicker recovery. What's practical about LITT is how it offers a safer option for patients who may not be able to handle traditional surgeries. For example, those with tumors in hard-to-reach places or people with epilepsy can benefit greatly from this technology. Patients often go home the next day and experience fewer complications. It's a perfect example of how advanced technology is making brain surgery more effective and less risky. Number 8. Gene therapy. Fixing the brain's DNA. Gene therapy is one of the most cutting-edge approaches in brain surgery. Instead of physically operating on the brain, this method targets the root cause at the genetic level. Doctors use modified viruses to deliver healthy genes to parts of the brain affected by disorders such as epilepsy or even genetic forms of blindness. What makes gene therapy so exciting is that it could provide long-term solutions to conditions previously considered untreatable. Imagine being able to hack the brain's genetic code to correct issues before they cause damage. This is the future of brain surgery, and while it's still in its early stages, its potential is enormous. Number 9. Functional MRI, or fMRI, mapping brain activity in real time. Functional MRI, or fMRI, allows doctors to see brain activity in real time, providing a detailed map of which areas are responsible for specific functions. By measuring blood flow, fMRI helps surgeons identify critical areas that control things like movement, speech, and thought processes. This technology is especially useful when performing surgeries to treat epilepsy or remove tumors. The precise mapping reduces the risk of damaging important areas of the brain, leading to better outcomes for patients. It's like having a live GPS of the brain, making surgery safer and more effective. Number 10. Artificial intelligence, the brain surgeon's smart assistant. Artificial intelligence is rapidly becoming a crucial tool in brain surgery. AI systems can analyze large sets of data, such as thousands of brain scans, to help doctors make more informed decisions. These systems can predict which surgical methods will be most effective and even anticipate potential complications before they occur. Patients, this means more personalized and accurate treatments. AI not only improves surgical precision, but also speeds up decision-making, making brain surgery more efficient and reducing recovery times. The future of AI in neurosurgery holds limitless potential for enhancing patient care. And there you have it, the incredible journey from ice picks to lasers. Brain surgery has come a long way, and who knows what the future holds. Stay curious, and until next time, keep exploring the fascinating world of science.